Okay, so we ended up on our last slide talking about condoms, and I had said that contraception maybe not so good, much better at preventing disease transmission. And so on that topic, we have the sexually transmitted disease (STD) and the newer form, the sexually transmitted infection (STI). Every few years, these words get modified because they become social stigmas, and so things change because of associations. When I was a kid, it was still called venereal disease. So the diseases haven't changed. What the way we classify them has changed a bit. But no matter what you call them, what they're describing is any disease that can be acquired as a result of sexual intercourse or other intimate contact with an infected individual. And this is an interesting statistic here. So go back to that age. I said, the brain develops age 24. 1 in 2 sexually active young people will get an STD by the age of 25. 1 in 2, 50%. Many times it's in the form of HPV, human papillomavirus, which usually clears itself. In 96% of cases of HPV, the patient has it and your body resolves it without you ever knowing it, and there are no long-term side effects. We'll talk about HPV more next week, but there's a lot of strains of HPV, and only 2 are indicated with genital warts and possibly with cervical cancer. We'll go into that next week. Anyway, so that's that idea of the brain not maturing up until the age around 24. And any of you who have car insurance and you're under 24, when you hit 24, your rates will drop significantly because the prefrontal cortex of the brain is completely developed by the age 25, and your amount of reasoning and your life experience added together allow you to make better qualified decisions. Between the ages of, say, 14 and 24, there are certain situations, especially with sexuality, decisions are made that can be dangerous and sometimes result in lifelong situations to manage, be that a child or an STD that might affect one's life. So always just be really careful and be cautious with sexual activity, and always make sure that you protect yourself and that you're open with your partner about it so that you don't transmit disease either way. One of the big concerns is that some STDs are symptomatic, so they show signs and see symptoms of disease. Others are asymptomatic. They show no signs of symptoms of disease. You can't tell if you have an STD. You have to be tested. I can't emphasize that enough. We've talked a lot about asymptomatic conditions since COVID's been around, and just be aware that some STDs are asymptomatic, and so they could have a devastating effect on the reproductive tract or other parts of your body, could end up in lifelong chronic afflictions, and it's all asymptomatic. It's going on. It shows up years and years later, and suddenly, oh my gosh, all these things happened. Well, you've had this disease state for all these years in that particular scenario. So some of the STIs to think about: chlamydia. It's the most common asymptomatic bacterial STI found in the U.S. It can cause infertility in both men and women if it's left untreated. Chlamydia, asymptomatic. When I used to work in women's health, any pap smear that was done on a female less than 40, we ran chlamydia on it. Often the patient would want to know why. We said, well, we just want to make sure you're clear. And they say, well, I've been with the same partner for years and years. Then we get a test back positive for chlamydia, and they get a big shock. They put 2 and 2 together, and you have to realize when it comes to sexual pathologies, there's 2 sides to the equation. So maybe you're in a monogamous relationship and have been faithful for 20 years, and maybe your partner has been saying that, but then you end up with an STI and you haven't had relations with anyone else. You put the picture together. So chlamydia is something we always check for, just to make sure, because it can have devastating effects if it goes untreated. In 2011, Santa Cruz County had the highest chlamydia rates of any county in California. So just keep in mind it's out there in the community. If someone has any of these STIs, it gets reported to public health. They don't release that information, of course, but they do ask you who you've had relations with so they can track them down and make sure everyone has been notified and tested to make sure that it doesn't turn into an outburst. That's called contact tracing. We're trying to do it right now with COVID, not working out so well. Anyway, to continue down the list, human papillomavirus, second most common STI in the U.S., can cause genital warts and cancer depending on the strain. You can be immunized against it. As I said previously, there are hundreds of strains of HPV. Only a couple are associated with these pathologies. However, there is a vaccine, and it's highly recommended you get it. And I believe you can still receive that vaccine up to the age of maybe 20 or so. So it's definitely one to consider. If you get the luck of the unlucky card in the deck, and you should happen to get HPV, that goes undetected, and it's one of the 2 dangerous strains, it could be problematic down the road. Genital herpes is a common viral infection marked by genital pain, tingling, and fluid-filled sores. I've seen more than a few young people get herpes. They have an initial outbreak that's horrible, and they get really upset about it. If there's any good news about herpes, it usually comes and goes, so it's not there all the time. We have very efficient medications in the form of acyclovir and valcyclovir that can control genital herpes and control the outbreaks. Some people never have another outbreak. Some people have them on a regular basis and have to take medication every day, and all kinds of combinations in between. It never goes away, but once again, it can be controlled, and it's viral, so it's not treated with antibiotics. It is definitely symptomatic. Genital herpes, if it's going to happen, it's going to be quite obvious. There will be open fluid-filled sores in the genital area and very uncomfortable. Gonorrhea is bacterial. It can cause infections in the genitals, rectum, and throat. It's a very common infection, especially amongst young people ages 15 to 24. It is symptomatic, and its primary symptom is a green foul-smelling discharge from the genital area. So if that's present, could be gonorrhea. It definitely needs to be checked out. It's something you don't want to ignore. Syphilis, a bacterial infection. Once again, very simple to fix with antibiotics. Starts as a genital sore, but can cause long-term complications if not treated correctly. Symptoms in adults are divided into stages, and so there's a whole lexicon of things you can know about syphilis. We're not going to go into them here, but here's a general kind of a general overview. So when you're talking about chlamydia, gonorrhea, syphilis, honestly, a gram of penicillin, usually administered once, will take care of those. And they can be asymptomatic. Chlamydia isn't asymptomatic. Not treated could end up being a bad outcome in the long run. So definitely a good idea to make sure that if you're sexually active and multiple partners that you get STD testing or STI testing. You don't want to acquire these and find out later damage has been done that you now cannot control. Okay, getting back to the male anatomy. I mentioned before the vas deferens, and you can see it here. And this is the duct that transports sperm from the testes to the urethra. When we talked about cardiovascular, I said we have many vessels in our body. If you recall, vaso is the combining form for vessel. And if you look here, that word root is part of this word, vas deferens. So you see it illustrated here. It rises out of the scrotum into the lower pelvic cavity, wraps around the urinary bladder. It looks like it goes into the urinary bladder, but it doesn't. It descends behind the urinary bladder where it intersects with the prostate. And there it is, vaso for vessel, if you'll recall. In this case, vaso also means vas deferens, but either way, whenever you see vaso, it's a vessel. It's carrying something from point A to point B. I mentioned earlier the vasectomy. This is the male reproductive method other than condoms, which, as we said, aren't really that effective. Vasectomy, excision of the vas deferens. So let me just go ahead and reemphasize here that when the testicles produce sperm, they're stored inside. The testicles produce testosterone, but that is secreted into the bloodstream, into capillary beds surrounding the testicle. So when the vas deferens is dissected, as you see here, they incise it and then tie the ends together, that is only affecting sperm transport. It has nothing to do with testosterone. I know there's a myth that and there's people that staunchly believe that it does. It does not. So I'm telling you from a medical standpoint, and this has been told to me by urologists repeatedly when I've asked, because I do ask about these things I lecture about to make sure you're getting good information. And every urologist has always been very clear with me about that. So that's the vasectomy. It's always okay for guys to step up and take control of the birth control. There are some that believe that it's the woman's job, if you will, and I mean that in a very loose way. And of course, I say it with a chuckle because we don't want to be sexist about any of this, but it is an option for males to prevent pregnancy. Let's say you get it done and you decide you want to have a baby after all. You can have a vasovastostomy, gentlemen. So this is a vasectomy reversal. So it's performed the same way the vasectomy is performed, with the exception of instead of incising and dissecting the vas deferens, they perform anastomosis. And if you recall again, that's joining two tubes together. And so they take those ends that they've cauterized or they've tied off, they surgically snip them off with some form of probably scissors or some form of scalpel, and then they're going to suture them back together. And it's remarkably reliable in terms of restoring that flow of semen through the vas deferens. So you can reverse a vasectomy if you want to, and here's how it's done. Urethra. We talked about this last week, so nothing new here. This is a structure that transports urine from the bladder, and in males, it also serves as a passageway for semen during ejaculation. So it is the route the semen will take, of course, into the vaginal canal, and as we talked about, the semen lubricating it, calming down the acidic environment of the vagina, and allowing the sperm to get up to what we call the external os, so it can enter the uterus and then find the egg, so on and so forth. We'll cover the rest of that in the next lecture. Now we have some pathologies, and these are congenital, hypospadias, a congenital defect in males where the urethra opens on the underside of the penis in an area where it's not supposed to be. So depending on where the urinary meatus presents, that's what we refer to the hypospadias as being. In other words, if you look at this is an uncircumcised male with the foreskin retracted. So we see the glans penis, which is often referred as the head of the penis, and the shaft beneath that. The normal urethral opening or urinary meatus is at the end of the penis. If the urinary meatus should appear on the posterior side or the bottom side of the glans penis, that would be glandular hypospadias. If it happened at the base of that structure, we would call it the coronal hypospadias. If it happens on the shaft, it'd be penile shaft hypospadias. And then we also see a perennial hypospadias all the way at the bottom of the penis. So urinary meatus could potentially appear in any one of those areas. And of course, it's not really conducive to the way things work. So usually there's a surgical correction that would be involved with that. We also have, in addition to hypospadias, we have epispadias. Now, I just want you to note, as you see this penis depicted here, this is anatomical position. So the part to the left, the front part, if you will, is considered anterior, and the part of the back or the bottom of the penis is considered posterior. So hypospadias happens in the posterior aspect of the penis. Epispadias happens on the anterior portion. It's also a congenital defect. In this case, the urethra opens on the upper side of the penis or the anterior side of the penis. Very much the same thing, just the opposite side. So hypospadias is posterior, epispadias is anterior. Bolano. This is a combining form for the glans penis. I just pointed out that's what is normally referred to as the head of the penis. So it's the slightly enlarged region at the tip of the penis. The corpus cavernosum. You have a right and a left one, gentlemen. And for ladies, any male you know, they have a right and a left corpus cavernosum. This is that spongy tissue that fills with blood that causes the male erection. So that's the way that tissue is placed. It runs laterally down the sides of the penis. The urethra would go down through the middle, of course, and there's not really much other structure there other than some capillary beds that deliver blood to the penis. So this is that spongy tissue, fills with blood, and is responsible for the male erection, which of course leads to intercourse and possibly reproduction. Bolano, for glans penis, we have a couple words. We have balanitis, inflammation of the glans penis, and bolonorrhea is a discharge from the glans penis. So ladies, you probably recognize some of these terms down here when we talk about candida or yeast infections. Thrush is what it's often called in men. Balanitis. It usually comes from men who are not circumcised, so they still have the foreskin. We'll get into that in just a moment. And the pathology usually happens underneath the foreskin, often the result of hygiene issues, especially in the form of yeast. And candida is just a form of a yeast infection. Irritation can happen. Any one of those, we're going to call it balanitis. That's inflammation of the glans penis. And that takes us to our 15-minute mark. I'm going to pause it here and be back in a moment with some more information.